Back to America's Forum. I'm John Bachman, filling in for J.D. Hayworth. We're also rejoined by Betsy McCaughey, a health policy expert, and Darrell Henry, the executive director for the Healthcare Coalition, or for Healthcare Coalition for Emergency Preparedness. Thank you both for sticking around for us through that commercial break. We'll pick up where we left off, guys. I'm looking at an article now on Newsmax.com, and there are dozens of countries, including some African nations, that have their own travel bans in place. President Obama, of course, said that we are not going to do this here in this country. Is that going to become another comment like he made, like the Syrian red line comment? Is the president going to have to go back on his word? Is he going to regret saying that? Darrell, we'll start with you.
He's going to get a lot of pressure to do that. And, you know, the efficacy of banning travel from Africa is questionable. Right near, I think we need to worry about containing it here at home and then deploying the troops in the medical facilities to really help stop it on the ground in Africa, because when the house next door is burning, you got to put that fire out before it catches yours. Yeah,
sure. Betsy, do you believe that?
That is absolutely wrong. The travel should be banned immediately. Every previous outbreak of Ebola was confined to the African continent. It is absolutely foolish for us to give this virus wings to infect the rest of the world, and it's being done for the sake of political correctness. Organizations like the World Health Organization are claiming that a virus that only affects 4 countries, there'll never be a cure for it. And for that preposterous reason, they are glad to see the rich countries of the world threatened with this because they believe it will produce a cure faster. We must close the borders and contain this virus.
Well, Darrell, I'll let you get a little rebuttal in. Talk about the efficacy issues that you just mentioned.
Well, with the 21-day, incubation period for the disease, you're not always going to catch the person coming in. So, and they can get in through other ways. So, it's questionable whether it would work. I think, putting folks on the ground out in Africa, spending money and the resources to stop the disease there should be the priority and what we should be focusing on. If it builds public confidence that we can, stop the influx into the country, fine, but it also has other collateral effect about getting workers there and folks on the ground over there to stop this.
That is incorrect. That is incorrect. We can get the healthcare workers in and out on charter flights and military flights. We do not need to endanger people flying commercially. So the travel bans should stop. And sending aid and workers to Africa and protecting Americans are not mutually exclusive. But our hospitals in this country cannot deal with Ebola. Hospitals that can't stop the spread of common infections like staph and C. diff that kill 75,000 people in this country each year certainly cannot contain Ebola. It is not a JV virus.
Darrell, how do you want to respond to that?
I was having trouble hearing what she was saying to the line here.
She basically said what you previously said about those efficacy issues. Betsy is telling us that she believes that they can still get in and out of these countries. The aid workers can fly on government or military planes, that there is no need for commercial travel at this point.
That is up to debate, and our focus is really on the domestic stuff and making sure that our hospitals are prepared here in the United States. So that's where we're focusing on.
All right, well, let's focus on that. Betsy,
Well,
let's focus. Let's talk about this a little bit more. Darrell, what is every hospital in the country doing today that they weren't doing maybe 2 weeks ago to prepare for the event that Ebola could come to their hospital, or even an Ebola scare, because we're seeing a lot of those around the country as well?
There's been a sharp uptick in work, and we're talking to hospitals across the country and their preparedness, and they're getting together. There was, a heightened alert before, then when they brought the first Ebola patient to the United States, an even more heightened alert. And now that someone walked off an airplane and walked into an American hospital, that has changed the dynamics. And it is obvious what we've seen at Presby that not all hospitals should be treating Ebola.
There you go, guys. And we'll have to leave the conversation there. We know that hospital clearly was not prepared based on what took place, and we'll talk a little bit more about that when they testify before Congress today. Betsy McCaughey and Darrell Henry, thanks so much for being with us. All right, America's Forum continues after this. We're going to keep talking about the Ebola issue, and of course, we're going to take a look at what's going on overseas as well with ISIS. I have a Newsmax Now update for you also coming up after this.